At one point, there was thousands, if not more, filler monsters roaming the streets. Walking around like having this much filler in your face is normal. When we talk about filler blindness, this is what we mean.
Well, I'm back with another Stephanie reaction. This one's called "You Dissolved Your Filler and It Destroyed Your Face."
It was never meant to go this far. What started out as a subtle way to enhance our natural features turned into a monster. No one walks into a clinic and says, "Hi, I'd like to look overfilled, please. Give me the pillow face look." It's always just a little, 1 or 2 mils. And that's how it gets you. Because a little looks good. Therefore, a lot will look even better, right? At one point, there was thousands, if not more, filler monsters roaming the streets. Walking around like having this much filler in your face is normal. When we talk about filler blindness, this is what we mean.
You're like a walking filter.
But I feel like because people might feel intimidated by you because you're perfect.
No, I do really struggle. I'm not going to lie, like, a lot of boys don't come up to me.
But luckily, the novelty and the filler blinkers wore off, and we were left with the mess that we'd created. Too much filler, overly inflated facial features that quite frankly look like they need a pin to pop them, and then you can like squeeze all the gel out, kind of like a massive pimple.
Well, that's actually one way to get the filler out. Of course, we have hyaluronidase, right, to dissolve the filler if it's HA filler. But another way is to actually poke at it and squeeze some of the filler out. And there are some cases where that's a better approach than just doing the dissolving. So yeah, I mean, I think even 1 to 2 mLs of filler can sometimes be too much. So I think it's always like the least amount necessary that should be the answer for the way filler is performed. But all too often the way like the financial structure is where you're paying for a syringe, patients feel like, well, I need to get that whole syringe because I paid for it. So that's part of the problem. And then, of course, you know, sometimes you have too much incentive on the side of the providers where they just want to inject more and more and more and keep people coming back. So there are a lot of issues around financial incentive with filler and how they're performed in general.
So what's a girl to do when she wakes up and realizes that the trend has changed and she's got too much filler in her face and she wants that filler gone? You just get it dissolved. No biggie. And so this is what the girls did in their droves. It became a whole movement. Come get filler dissolved with me was the new trend.
And we do have a video that explores the downside of dissolving filler and some of the changes that can result from that people may have never expected. So if you are interested in this topic, definitely check out that video as well.
Come with me to get my lips dissolved.
I just got my lip filler dissolved.
Today I'm getting all the filler dissolved in my lips.
Gonna get all my filler dissolved.
Come with me to get my lip fillers dissolved.
The girls were dissolving their filler like it was going out of fashion, because quite frankly it was. Thinking nothing of it. What are we injecting? We don't know. We don't care. Are there any side effects? Yeah, I'll have small lips again. Big odds.
I went and got lip filler when I was around 16. Filler was literally like going to the gym. Like, I'm just going to go get a top up of my lip filler. It became so normalized. There was this one pivotal moment where I'd gone and I'd got loads of filler and I posted a YouTube video. My face was literally like, it was just awful.
Today I am getting my lips dissolved. I've been getting my lips filled with filler since I was about 17. I have got lumps in, they've got bumps in, they're uneven. I reckon in total I've probably got about 5 mil of filler in these altogether.
Yeah, people just assume that it's going to reverse back to exactly how the lips once looked, but oftentimes that's not the case. And part of the reason is because of the aging process, especially if people have been getting filler in their face for, like, let's say a decade plus, and then they go and they dissolve, you know, they think it's just, you know, they're going to look like how they looked a decade ago, but that's not the case because aging continues. So the face sags a bit, it thins out a bit. It's just the way, you know, aging happens, right? So then they don't look exactly like they used to. And sometimes they're not happy because of that. Also, we know now that filler does migrate and it can be challenging to get all of it out. That's another problem. And yet another issue is that when you inject filler, you're kind of expanding the tissues. I always give the example of a balloon that's expanded. When you go to take air out or water out of a balloon, what you'll find is that the shell of the balloon doesn't come back to exactly how it once looked. It will look a bit more stretched out, and the same happens in the face.
I wouldn't want to say that I started a trend, but I do feel like I did start a bit of a trend with the sort of dissolving.
This idea that you can just dissolve filler like it's no big deal was almost sold to us along with the filler as a package deal. A way to make filler seem less intimidating, less daunting, less of a big deal. If it goes wrong, if you get too much, if you just don't like it, it's fine because you can just get it dissolved.
That's a good question. how reversible is the filler, right? And surely it's better than silicone that we don't have any agent to dissolve it with, but HA filler is, in my opinion, not necessarily fully dissolvable. And then, of course, the dissolving itself carries some risk. So I'm sure she'll get into that. So let's keep listening.
Except a lot of the girls that got their filler dissolved started noticing something. Something was going wrong. Their faces looked worse than before they ever even got the filler.
Right. So again, going back to what I said, some of that is the aging process, and some of it is because the hyaluronidase can dissolve some of the natural tissues. And there was a time when that also was sort of sold to us by the companies that like, no, it only targets the filler, the HA filler. But remember, we have HA throughout all of our cells, right? So to think that hyaluronidase would only affect the injected filler HA and not our natural HA sort of makes no sense. And one of the issues here is that the dosage or the concentration of Hylenex that's used to dissolve the filler, in my opinion, is often a bit too high. And that can cause burning, and that can also cause some of those natural tissues to thin out.
Some noticed their skin was sagging. Some people said their faces looked hollow. Some girls claimed that they looked 20 years older than they actually were. And it wasn't the filler causing this strange and disturbing phenomenon. It was the dissolver.
Could dissolving your filler permanently destroy your face? I'm hearing a lot about this Facebook group where people are claiming that after they got their fillers dissolved, their face has drastically changed and they look worse than they've ever looked. There are people that have had this procedure where they've had filler dissolved and now something's happened that we can't really explain.
But also it's because the people have gotten used to a certain look and they're not used to like their original look, or how they don't know how they would have looked if they just never did filler. So that's part of this. It's not just the dissolving, but again, it's the dissolving at high concentrations that leads to some of this. So when I dissolve, especially lips, prior to lip lift surgery that I perform, we'll use a diluted version of the Hylenex, typically just 0.1 cc's in 1 full cc of injectable saline. So only 1/10 will be the Hylenex and the rest will be just injectable saline to dilute it. So that still gets the dissolving done well, but it protects the surrounding tissues. And we have a video where I show how I dissolve lips if you want to take a look. But I think that's one of the keys. And oftentimes providers, I think they mean well. So they use the very concentrated form, like what comes out of the actual bottle of Hylenex. But I think that's actually causing some damage.
How is this even possible? There was no evidence that this could happen. Some doctors even told me it was my mind. There was a complication at the last dissolving in which they dissolved my fat. I didn't know that could happen. So every time I would look in the mirror, I would cry, thought I looked like a skeleton.
As the dissolving process started and the days went by, I began to notice changes in my appearance that I had not anticipated. And I developed very strong doubts in my decision to dissolve.
So a month ago, I had my tear trough filler dissolved just under my eyes here. So since having it done, I've not been feeling great about my face. I feel like my under eyes are very hollow. I've sort of lost definition on my cheeks here.
But again, she may have looked like this, like without the filler, right? So it's kind of hard to know, especially if the filler's been there for a few years, how exactly things would have changed with the aging process. So there's a few things going on here.
Fix one problem, create a new one. Because here is the problem. To dissolve filler, you need to use a drug called hyaluronidase. This is an enzyme designed to break down hyaluronic acid, and hyaluronic acid is what fillers are made out of. So far, so good. Sounds effective, right? Yeah. It was too effective, because hyaluronic acid isn't just in filler. Hyaluronic acid exists naturally in your skin, and it's pretty bloody important. It's basically a large part of what gives your face structure, hydration, and support, aka that youthful, plumpy glow that we all want and love. So what do you think happens when you inject a drug into your face that is designed to break down and get rid of hyaluronic acid? Yeah, you're right.
Are we able to target areas to dissolve?
No, there's no such thing as spot treating with Hylenex or hyaluronidase. It is a fluid. It gets injected and it eats away at all of the hyaluronic acid that is existing in that area. You cannot say, ooh, stop right there. Absolutely not. It is going to target the artificial hyaluronic acid that was injected in there and even some of your own tissue.
Well, I mean, you can still target a general region, and with smaller quantities, it's not going to spread all the way throughout the face. So, the truth is somewhere in the middle, as it often is. So yeah, just like with injecting filler, can you hit just one little spot? Sort of. I mean, there's going to be some dispersion and extension maybe beyond exactly where you want it to hit, but it doesn't mean it's going to end up on the other side of the face per se. So the same with Hylenex or hyaluronidase, which is the same thing. Yeah, I mean, maybe not complete exact spot treatment, but you can hit a smaller region with low quantities and proper, administration of the fluid.
Let's get it.
If you're one of the girls who got her filler dissolved and wonders why she looks 20 years older overnight, this is why. The thing is, when you inject hyaluronidase into your face, it doesn't have the perfect target. It doesn't segregate between hyaluronic acids. So yes, it breaks down the hyaluronic acid in your filler. It also breaks down the hyaluronic acid that naturally occurs in your face.
This is too much for me. This is an enzyme that breaks down filler in our body. The only thing is it can't differentiate between our normal hyaluronidase that we produce in our body and the synthetic hyaluronic acid that we have.
And that's again why using more dilute forms of the hyaluronidase I think is the better way to go. But for whatever reason, that has not been popularized. But maybe now when people see my reaction, they'll start asking their providers for more dilute forms of it.
And what's even more disturbing to me is that hyaluronidase isn't even formally licensed to be used specifically for filler dissolution by the FDA or the TGA here in Australia.
A drug called hyaluronidase is injected into the skin to break down filler compounds and skin tissue. Its off-label use in cosmetic procedures is unapproved, untested and unregulated. Now a British study has found 20% of 150 patients had adverse effects from the drug.
This means hyaluronidase is being used off-label to dissolve filler, which is just a little bit concerning because when something is used off-label, it means that it's not a standardized, thoroughly studied cosmetic procedure.
Remember that most fillers are injected into areas that are also off-label. So, I'm not saying that's right, but that's very common. And we use medications in off-label ways pretty often in healthcare. So it's not super unusual, but it is a good point that there's less testing, there's less knowledge base maybe about how exactly it works and, maybe some of the disadvantages of it.
And what exactly does hyaluronidase do to our surrounding tissues over time, long term? Well, we don't know because we don't have clear, concise answers because, quite frankly, we haven't done long-term studies.
Skin hanging from the bones.
My face is literally like a rag. Collagen, elastin, it's all loose. My skin isn't attached to my face.
This Russian woman is one of many patients around the world reporting devastating side effects after a popular cosmetic procedure, the removal of facial fillers that some claim has impacted their whole body. Queensland woman Agnes had lip fillers dissolved 2 years ago. She says what began as a feeling of numbness soon escalated to indescribable pain.
My body was near convulsing. My head felt like it was in a vice, in a grip. My jaw was aching.
So when we hear girls saying, I got my filler dissolved and now my face looks hollow, my skin feels different, I look older than before I ever even got filler, they're not making this stuff up. And what's even more concerning to me is that the women who claim that they have been permanently damaged by hyaluronidase are essentially being ignored. Their evidence brushed off as being anecdotal, therefore it doesn't matter, or told that their instantaneously aged faces are a result of not being used to their filler being gone. These women are essentially being gaslit that they just don't remember what their faces looked like pre-filler, that they're just not used to not having so much filler anymore.
Well, I think there is something to that, though obviously that's not the full story. But it's different again if someone was young when they first had filler and then they're still very young and when they dissolve it. So if it's been 6 months or a year, that's different from someone getting it in their 30s initially and then getting it dissolved at 45. I mean, of course, they're going to, sense those aging changes a little bit more. So I think that's part of the answer, but obviously not the whole thing. And of course, there are, potential side effects that might be systemic that one woman was describing where she felt this looser tissue in other parts of the body. I mean, I guess, it's possible you're injecting into blood vessels in the face and things get distributed throughout the body. So, I think hypothetically, if it's large enough quantities, are they then leading to the hyaluronidase getting circulated more broadly throughout the body and then having these effects of dissolving your natural HA in the tissues? I mean, maybe. So I think it's important to raise these concerns and take people seriously when they report these things and study them, and hopefully there'll be more of that to come.
And this is why they feel like they've aged 20 years overnight. This is why their skin feels weird. and this is why their faces are sunken.
And some doctors even told me it was my mind, like if I was crazy.
Hyaluronidase. Will it dissolve your face? We need to tease out why a minority of patients are so unhappy after hyaluronidase. The first option is that hyaluronidase really is causing a physical problem in a minority of patients. The second is that hyaluronidase is used in conditions where it's very easy to create the perception of a long-term problem. The second is acclimatization to an overfilled state, and then a reversal to normal, which simply feels much worse than normal because it is so shocking to lose so much volume so quickly.
I don't think so.
I think all of that is true. I think all of it is true to varying degrees and, will vary from person to person. So in some people, there might be more of that component of, not realizing how you would have looked without the filler, or forgetting how you looked or not knowing what that natural aging process would have been. And in other people, they're really having, ill effects of the dissolving. I think, both can be true.
But the girls are like, no, something is wrong here, please listen to me. My skin is sagging. It feels like bubblegum. I can stretch my face. My legs hurt. Now the science backs this up. It is well documented that hyaluronidase does in fact dissolve the body's own hyaluronic acid, not just the filler. That's proven. We already know that. But we've been reassured that our bodies should replenish this lost hyaluronic acid in a few weeks.
But again, it depends on the quantities that are injected. So I think most of the time it's, out of still goodwill that providers are using just very concentrated high quantities of the hyaluronidase. That, of course, will potentially be more damaging to the natural tissues compared to using less of it. So I caution people on using a ton of the stuff without thinking of some of these problems that could come about.
Oh, please help me, doctor. Hyaluronidase ruined my skin. My name is Rebecca Goodell. I'm a medical doctor and specialized in aesthetic medicine. Can hyaluronidase ruin your skin and eat up your fat and collagen? Is this possible? No, it's not. But we do have hyaluronic acid in the skin, and this hyaluronic acid can be affected by other hyalase. But all of the HA in the skin is going to be replaced with new one. So even though the hyaluronidase removes a little bit of your own HA, it will be replaced within 24 hours, and you will even have more of it. Are you sure?
Yeah, I'm not sure what she's basing that on, and I don't think that that's been documented to be exactly true. And again, we don't, what quantities is she talking about? Maybe up to a certain amount that's injected, that's true, but maybe after you reach a certain threshold, that is no longer true. So there's a lot to, I think, still research here and to further unpack and discover.
Except for a lot of us, that simply does not happen. What happens is a permanent deficiency and significant lack of volume in the areas that were dissolved. And no, it is not simply because of a lack of filler. It is the lack of our own natural hyaluronic acid that was helping to hold up our faces.
Some doctors say your hyaluronic acid will come back.
Oh, look, it's Ben. I haven't seen Ben in a few years, but, he's an old friend.
I'll tell you for a fact that is an uncertain statement. You cannot know if the hyaluronic acid will ever come back because I've operated on people who have had dissolver, and I know the natural thickness of the SMAS in different areas of the face. And people who have had dissolver before, sometimes even 4 or 5 years later, I've gone and made incisions for a lip lift or a facelift, and their SMAS is still thinner than it used to be. So some people never recover their hyaluronic that you dissolved. Some people do. You don't know who that's going to be.
Yeah, I think Ben's taking a very practical perspective on this, and I would largely agree that, again, depending on how much is injected, I think, and of course on the person and the variability from person to person, sometimes some of it might come back, sometimes, none of it will come back. We just don't know. But again, to be safe, you want to use more dilute forms of the hyaluronidase because typically I found it's very much enough to dissolve the filler. So again, dilute it, people, please. That will, I think, save a lot of folks. I've never had a dissolving, gone bad, and I think it's because we just use low quantities.
Now, I am not trying to fearmonger here. It needs to be said that this side effect does not happen to everyone. Some girls get their filler dissolved and they look absolutely amazing. Everything is fine.
I did a reaction short to this person and her experience with the dissolving, so we're going to play that here. She's getting her lips dissolved. So oh, shoot. Whoa. Yeah, I don't think she's going back to the pub. You know, people can get allergic reactions to the Hylenex, which is what's used to dissolve HA filler. And it's really scary when that happens because the whole face can swell up. And when you have so much swelling, you worry about internal swelling as well. So sometimes it's best to go to the hospital and get checked out so that they can make sure that your heart and lungs are performing well and that you're not having any internal swelling, such as in your throat, that could potentially compromise your breathing and cause catastrophic complications. So the lesson here is that even with something as seemingly safe as hyaluronidase or Hylenex, you can still run into some potential issues, even if it's performed in good hands. So you have to consider some of these risks, especially when you're trying to make it work with the rest of your life and social activities.
But when enough women are complaining of a side effect of what is essentially a drug, we can't simply brush this off. Like, somebody should be investigating this. Somebody should be doing the studies. But to my knowledge, nobody is.
Doctors say more research is needed, while patients are pleading for regulation and accountability.
You know, and this might be one of the reasons that more and more facelifts are being done on younger patients because of this phenomenon, I think, in part, again, one of the reasons. But, you know, if filler was never a big deal until it was, right? In like late 2010s, 2020, people really started to do a lot of this. And then as people have gotten a lot of the filler dissolved, they've found that, yeah, the face is a little bit more loose. And, you know, then we also have the Ozempic and GLP phenomenon where, again, people are losing some volume in their face and their tissues are more saggy and then they want it lifted. So sometimes even in their late 20s, 30s, you know, no one used to get facelifts at these ages, but now they are. And I think this might have, again, something to do with it. And, you know, this video, watching this and thinking about it is kind of helping me realize that. You know, that's probably one of the contributors to people getting facelifts at younger ages. And I no longer perform facelift surgery, and I have a video on why that is. So if you're curious, make sure to check out that video.
And here is where the vicious cycle starts. Girl gets filler. Girl gets more filler. Maybe gets overfilled. Maybe decides she just doesn't like it anymore. Decides to dissolve the filler. And ends up accidentally dissolving her own face. So now she's unhappy. She's self-conscious. She feels like she looks droopy and saggy and older than she is. So what choice does she have now but to go back to the clinic and get more filler injected to correct the volume loss that was caused by the dissolving agent?
Or to get a facelift with fat transfer, right? I mean, that's going to be the surgical alternative, and that's been on the rise, and probably this is one of the reasons.
It should be noted that I wondered what I would look like without that filler. Would I actually look better? Well, I got the visual that I needed, which just confirmed my decision to replace the filler as soon as I could.
Guess who is happy again because I got my under eyes filled yesterday.
So you have girls getting filler, dissolving filler, getting filler again, dissolving filler again.
The vicious cycle just keeps repeating itself.
The time has finally come. I'm getting my lips refilled today. I got my lips dissolved 2 weeks ago now, and let me tell you, it has been the longest 2 weeks of my life. I've never felt so ugly. I was hoping that the natural lips would grow on me, but nope.
You know, when I do lip lift surgery, like when people reach out for consultations, they will often send us photos, right? We request the photos just to see as a, you know, first kind of check if they're a reasonable candidate based on their requests and also how they look. And a lot of times I'll see overfilled lips. So I'll tell people, okay, yeah, we can evaluate you in person for a lip lift procedure, but we need you to dissolve the filler in advance of that visit. And it's pretty amazing how often we're told, like, I don't want to do that, then I'm going to spend too much time without filler, and I don't like how that looks on me. And, you know, they don't know if they're going to be exactly deemed a candidate for the surgery. And they'll, of course, have to wait at least some time from the consultation to actual surgery, even if they are candidates. And just the thought of having to live so long, even if it's a few months, without any kind of filler or any volume in their lips kind of can scare people. It's interesting, you know, but I feel like it is helpful to see the lips in a slightly more natural state as I evaluate for a surgical lift. But again, this is why lip lift surgery, you know, kind of has been on the rise, because again, people don't want to keep going back for filler, then dissolving, then filler. And the lip lift does bring in some volume. I mean, it's not exactly the appearance of filler, for better or worse. You know, there's different kind of qualities to a surgical lift, but that's why a lot of people are considering that. And if you want to learn more about lip lift surgery, make sure to check out this recent video that I put together. And check out our gallery if you're considering this type of procedure to see if it's something that you might like. And you can always reach out to our clinic to find out more about how we approach the surgery that on the surface seems like, hey, not a big deal, just remove some skin under the nose, but has a lot of nuances and, specific kind of qualities to it, and very specific techniques that are required to get very good healing. And I think that it's overlooked by a lot of people, including in the surgical community, and underappreciated. But it's a very powerful technique, but it has to be handled the right way.
Who remembers when my lip looked like this? It's like, how could you forget? I did that so that I could have a clean slate and re-inject them.
We have dissolved her upper lip. We had a little bit of migration.
Nothing can be worse than the dissolver.
I know.
Like this is a walk in the park.
This is a very soft, nice, very nice filler.
And it's like, where does it stop? With a facelift. Apparently, if you ask influencer and podcaster Ashley Stobart, who has so much filler that she subsequently had to dissolve it, who was then left with so much loose skin on her face that she felt the need to undergo a facelift at the age of 34.
What the f***? She's 34. This is insane.
I've had so much.
How did you end up in this situation where you're like, I'm doing a facelift?
Yeah, and I reacted to this as well in the past. So make sure to check out that video if you're curious about my thoughts on that woman.
Thoughts is how you got to that. It honestly, like from years of filling, dissolving, treating new all this, I just had lost definition in my face. I didn't look like me anymore because I'd been filled out, put back in. And then they ended up getting 4 centimeters off each side of my face.
Yeah, and then the real concern here, and I've talked about this in some prior videos, is that with people getting their first facelift in their 20s, 30s, the issue there is that they start to notice some sag, of course, happening within even the first few years of the surgery. So then they're getting more surgery and another lift and another, and then that's going to build up scar tissue. And eventually what's going to happen is that there's going to be more risk to the underlying tissues. It's going to get harder and harder to separate those planes. So the facial nerve, some important vessels are going to be in a riskier place. And you'll see this happening, my guess is within the next 5 years, is that there'll be more facelift complications because now people are doing the revision after revision after revision. Eventually it gets harder to do the surgery and to find your planes and to keep things safe. So again, that is the risk of starting these facelift surgeries that are no joke much younger in life. And again, I think this will play out probably over the next 5 years or so. And it'll be one of those, Linkov told you so moments. Let's see how it unfolds. But that's my biggest concern at this time.
Squeezing filler out of my face for hours. Like I've got these videos on my phone that my friend took, and it's just like they're green, aren't they, Lauren?
I was in surgery for 9.5 hours, and then he was picking filler. My husband kept ringing up and being like, "Is she okay?" And they were like, "We just can't get all this shit out." I've shown you the pictures. Some of it was just like green balls of pus that had got like infected. Be careful what you're putting in your face.
Now, I am not making this video to discourage anybody from dissolving their fillers. It's your face, your body, you're a big girl, you do what you want. However, in saying that, I do think it is of the utmost importance that we are fully informed and aware of the potential downsides of this treatment prior to getting it done. Let me know in the comments down below if you guys have ever dissolved your filler. Did it go well? Did you notice any side effects? This would actually be a very interesting pseudo study, a collection of anecdotal evidence, if you will, of you guys sharing your experience with hyaluronidase and with dissolving your filler. I will see you in my next video, which is actually part 2 of this video. And I'm literally going to film that one right now. And then I'm going to edit them both up together. And I'm going to try and get both videos out in the same week. Let's see if I can do it. Everyone thinks I have this like filming team and like a thumbnail team and editing team. I am the team. I research my own videos. I film my own videos like a little hermit here in my room. I edit my own videos. I do the thumbnails. It is so tedious and time consuming. This is why I hardly ever get videos out. Oh my God, the state of my nails. Okay, bye. Bye!
Well, it's impressive that Stephanie's able to do this on her own. I definitely have people who help me with some elements of this stuff so I could still do surgery. But we plan on reaching out to Stephanie to see if we can do a nice collaboration for an upcoming video. So if you guys want to see that happen, you can go and maybe comment on some of her videos to say like, yeah, do the collab with Linkov. I think it would be really interesting. I've done a number of these reactions. We've never actually talked to Stephanie directly, so I think it would be cool. I think I agree with her on a lot of the different points that she makes in her videos. I find her stuff very entertaining. I know you guys enjoy some of these reactions. We have maybe a slightly different style, but I think Stephanie approaches this from a caring place and does good research that go into her videos. So yeah, it would be a real pleasure, I think, to record something together with her. So maybe stay tuned for something like that. Thanks again.